Hello, my name is Heather Bailey, and I would like to talk to you today about a growing problem in the healthcare community, the nursing shortage. I've entitled today's PowerPoint, An Illusion in Healthcare, the Disappearing Act of Nurses. The imposing nursing shortage in the United States is brought on by many factors and carries with it a heavy impact on the nursing and healthcare communities. According to the American Association of Nursing, by the year 2025, there will be an estimated shortage of 260,000 registered nurses in the United States. What did our country do to be in such a dire situation? What we're going to do is start with a brief history of the nursing shortage and see how that allows us to fully understand the problem. The first major nursing shortage in the United States started in the 1990s. This was brought on by many of the hospitals during that era, focusing more on their profit margins than patient care, and this is brought on by the nursing advocacy. Then again in the year 2000, the United States government took a census and saw that the trends that were prevalent in the 1990s with hospitals focusing more on profit margins rather than patient care was being repeated. This sparked a concern for the U.S. government to kind of take control and see what they could do to stop this situation from happening again in the future. According to the nursing advocacy website, they gave 4 main types of the nursing shortage, and every resource that I have pulled falls in this category, but I like the way they had that laid out. The first type is the willing nurse shortage. Second is a funding shortage. The third is a shortage of understanding that nurses are needed to deliver care. Fourth and finally is a shortage that I find very disturbing, and that's a lack of education and public awareness. We'll start by looking at each one of these individually. The willing nurse shortage. What is meant by that definition is basically there are not enough nurses to fill the job openings that are available. It will continue to be a problem due to the increased number of nurses scheduled to retire by the year 2020. Also, there will be influence there by the number of people who could possibly receive government-funded health care if the government goes through with their Health Care Reform Act. And this information was taken from Nursing Advocacy website. The second type is the funding shortage. This type of shortage is created when a hospital or medical institution does not have the funds necessary to adequately staff their facilities, similar to what was seen in the early 1990s. Third, there is a shortage of understanding that nurses are needed to deliver care. According to the Nursing Advocacy website, it became easier for hospitals to hire non-licensed staff to perform many of the care or job duties that nurses performed during that time. This led to a lot of hurt feelings for nurses, and many of them became somewhat disgusted with their job duties and seeing someone step up and do them that was not licensed and chose other routes as far as employment. The fourth and final cause for the nursing shortage that I felt was such a waste, it could really be prevented, was the lack of education and public awareness. One major impact, according to the Nursing Advocacy website, fueling the nursing shortage is the lack of educators in colleges and universities for their nursing programs. Also in the book, Prescription for the Nursing Shortage, the term bottlenecking is used to describe this. Basically what they're saying is there is an overflow of students and there's not enough open positions available for them to enter the program. This is in turn causing many of the students, according to Schaefer, which is the author of another book, to change their opinion of what they would do for a career. If they can't get into the nursing program, they'll look at another avenue. Now, the negative impacts of the nursing shortage, according to the Journal of Healthcare and Human Resource, these were the impacts that they had listed. Restrictions for admissions for patients in hospitals. This is emergency, general, all of the above. Basically, if you're sick or hurt, they may not be able to take you because they're inadequately staffed. Also, many hospital emergency rooms are closing units due to not enough medical staff. A chief nursing officer stated in an interview that injuries were also a concern. The higher the patient-to-nurse ratio, the greater the occurrence of injuries to the patients. Now, this study was done by Bear House. Then, the United States government, they decided to release a study on the effects of patient care and recovery pertaining to nurses and their high patient ratios. Patients who received more time with nurses or medical staff showed a higher success rate with healing versus those who were not available to medical staff. And how does this impact Tennessee? In Tennessee alone, the nursing shortage right now equals 2,800 nurses. By the year 2020, this number will have jumped tremendously to 14,910 nurses. And this is information given by a nurse. Her last name is Murray. She based this on the aging workforce of Tennesseans being 65 years or older, and that does increase their need for medical care. But there are possible solutions to the problem. Across the country, medical and government institutions are devising solutions on the shortage. One of the ways they're doing this is offering incentives. And according to Schaefer, what they're doing is offering student loan forgiveness, also sign-on bonuses. Many of the hospitals locally are offering that as well. Then Satterley goes on to say that they are also addressing complaints from former nurses in the past, like we talked about, the ones that had higher patient ratios and also saw non-medically licensed personnel. What they're doing is they're improving the workplace and improving the nurse-to-patient ratio. These are the sources I have listed, and I appreciate your time concerning the matter, and I would encourage each and every one of you to continue to look into the problem. Even if you're not going to be going into the medical community or being a nurse yourself, there's still a focus there that is going to affect each and every one of us. So educate yourselves, educate those around you, and thank you.